I was born in Los Angeles, California. I grew up in a small town called Carson, California, which will hopefully be the new home of the Raiders and the Chargers in the next couple of years. Lived there until I was 17 years old. Then I finished high school at St. Anthony's in Long Beach, California. Then I started college at the United States Military Academy, West Point. I went to the academy for 2 years before I transferred from the academy to Howard University in Washington, D.C. I was in D.C. for a total of 6 years, where I did my last 2 years of college, undergrad there, and then I did my 4 years of medical school, also at Howard University. When I finished Howard, I then went back to the West Coast to go to UC Davis East Bay in Oakland for residency in general surgery. I loved being there because that program was a combination of what was previously 3 surgical programs, one for the U.S. Navy, one for Kaiser Permanente, which is a bastion of California healthcare, and then where I was Highland Hospital, which is kind of our county versus kind of like we have here in Louisiana, the charity system. So that hospital gave us a really good trauma experience. So I was there for 5 years for general surgery. My focus when I was there was on laparoscopic surgery. I'm a young guy, but I'm also one of the old guys in terms of laparoscopic surgery because back then there were very few programs that were training people to specialize in that kind of surgery. So my program kind of let me kind of carve out my own niche to do laparoscopic surgery, which is where I've been doing for the last almost 15 years. So when I finished residency in California, I came to Louisiana. My wife is from Greensburg, Louisiana, so she wanted to come home. So I started my first practice, my own solo practice, in Zachary, Louisiana, just north of Baton Rouge. And I was in Zachary for 9 years before I joined the Baton Rouge Clinic. I've been doing weight loss surgery predominantly since 2012. We also do all types of cancer surgeries, abdominal surgeries, hernia surgeries, mostly abdominal, but also some soft tissue and skin disorders also. Everything we do is cutting edge now. I've been doing a robot surgery for about 3 going on 4 years, and the robot works wonders. I mean, one thing that I always complain about doing laparoscopic surgery is that you can't use your hands like you would normally. Your hand, your wrist rotate, they articulate, they move different directions. And what we had traditionally for laparoscopic surgery were just straight instruments. So we lost some of those degrees of freedom to do those things. With the robot, we have that back. So anything I can do open, I can do with the robot, which makes things a lot easier for my patients and what makes it easier for me. Also, the robot has 3D vision. So you get much better depth perception than you would imagine looking at a regular camera screen. So technology is a huge part of our practice. As well, now the Baton Rouge General facility has 3D cameras that we use as well. So we have 3D vision now for laparoscopy as well as for using the robot. So the sky's the limit for technology. It helps our patients. We have shorter operative times. We have shorter hospital stays. People do much better with this kind of care. And what I think one of the things the Baton Rouge Clinic can offer our patients is that we have myself, Dr. Fraley, Dr. Bonner, Dr. Swartzberg, all doing things that most other surgeons in Baton Rouge aren't able to do. You know, I tell my family members, they always wonder, are you going to preach? I'm like, no, I'm not a preacher, I'm a doctor. But for me, my chance to minister is to my patients. So I tell my patients whenever I see them, I always ask them, did you pray? Because before operating, I tell them, look, you better pray because I'm praying. You know, so it's my chance to extend myself to my patients and understand that, you know, I'm a Christian, I believe in God, and it's good to have somebody have some faith and some belief. And I love sharing it with my patients because that's what I'm here to do. That's why I think God put me on this planet is to help people, is to make sure that they're taken care of as best as possible. And I wouldn't offer anybody any care, I wouldn't offer my own family members. And I think that's one thing that I personally practice, as well as my partners in the clinic practice as well. We put the patients first, we do what's best for our patient, giving them the freedom to choose what they like, and to make sure that whatever we can do that's safe and what's right is going to be done for them.